Canada's healthcare system costs taxpayers roughly $200 billion every year. Our aging population has some predicting that's a figure that'll only skyrocket if across-the-board efficiencies aren't implemented soon. Cash-strapped provinces, including Ontario, are leading the charge to cut costs by reducing the fees paid to physicians. Jeremy Behar is the president and CEO of the Cirrus Consulting Group, which focuses on business solutions for doctors and dentists. Great to have you back.
Thank you, Amanda. Appreciate it.
We wanted to talk to you because we talked a lot the last time, and not everyone will have seen it, and so we'll cover some of the ground about what you do. But efficiencies really is what we're after, and some of them have been found in some parts of the system, and I think what the governments are saying is, let's pass this on. How many regular doctors' practices could be way more efficient than they are today?
Yeah, so I think in generally, and to answer that, it really is a generally speaking, it's the overwhelming majority of the primary care delivery and the healthcare delivery model across Canada that has a tremendous opportunity to become more efficient. And so a very high percentage, to answer your question, yeah, definitely.
And yet you won't go to the real answer, which is privatization of medical services, right?
I'm happy to go to that answer. What's the question?
Well, I mean, this is what I've been asking. How can we possibly get efficiency in a model that doesn't have competition in it? Because the way I look at our Canadian healthcare system, it's broken. We can't afford it decades from now. We can't even afford it now. Why not just privatize it and let's rock and roll?
So I think that the privatizing question, and we did touch on this a little bit last time, there is a two-tier medical system in Canada, and I think that comes as quite a shock to many people. It exists today. Yeah. As a patient in Canada today, one has the choice to either go left and onto the social system conveyor belt, or to go right and shop for care in a private clinic, or go south of the border, which increasingly more and more Canadians who can afford to do it are doing it. What that is doing in the Canadian system is it is, albeit very slowly because it's a change management process, it is slowly and incrementally freeing up room on the public system conveyor belt for more people to fit themselves onto it, while the two-tier system, the private system, continues to grow, to increase, to penetrate more markets across Canada.
The government in Ontario really has targeted doctors. They've targeted a couple of specific specialties where there really have been amazing efficiencies, and the fees have stayed level. So that's a fight that I guess they're willing to take on here.
Absolutely.
But what about the family physician? Because people get really nervous. There are still people who can't find a family physician. Are we concerned that if we start to kind of play around with their ability to make a decent income, and it's not like they make crazy amounts of money, will they leave? Are we actually going to lose people out of the system?
So my opinion is that on the basis of where the Ontario government is going now, and what we'll see is that more provincial governments across Canada, they will continue to move in this direction. A decade ago, a couple of decades ago, we had problems where there was huge orphan patient populations in Canada. It was very difficult to get to a physician. It was very difficult to get access to a physician within a short period of time when we ultimately need it. And so the governments across Canada increased funding to schools, enrolled more students, spit out more medical students more physicians into the population. Unfortunately, what was happening then is that they were then turning around and moving south of the border. Right. About a decade and a half ago, in Ontario, the Ontario government increased the amount of funding that it poured into the system, both in terms of schools, more doctors, let in more doctors from outside of Canada, and started to throw more money at physicians to incentivize them to take on more patients, spend more time with them, and help that orphan patient problem. Now what's happening is the Ontario government and governments across Canada are looking at the problems that they're trying to solve and are saying, okay, like most of the problem solving that we do as governments, we can't always just take big wads of money and throw it at a problem and hope that that problem is going to get solved, which I think has been a big part of the problem that has led to the differences between these two sides today. Sure, they're getting paid better. Sure, there have been increases in benefits to patients across Canada and the population in general, and yes, physicians are making more money. Now what's happening is we're getting into a different stage where, as opposed to just trying to solve problems by throwing money at it and paying people more, now what we're doing is we're looking at the system and saying, okay, performance, which has been a key part of the private sector and every industry across the planet for a very long time now, needs to become a component in healthcare, where we don't just start to look at delivering care and doing it in an episodic basis, and the patient comes in, the patient goes out, and really there's nothing. Yeah. We need to figure out how to get patients healthier, how to manage outcomes better. Yeah.
I want to go back to something you said earlier, just to clarify it, because I am one of those people that don't burden the Canadian healthcare system. I buy my health care south of the border, including getting my teeth cleaned there. I don't like social medicine. But is it true that if I wanted a hip replacement tomorrow morning, I could jump the queue and buy it here in Ontario? Because I can do that in Boston.
No, you couldn't.
Right. So this two-tier isn't real. It's not real.
Well, you could. I'm not suggesting that the two-tier exists at Mount Sinai Hospital. I'm suggesting that the two-tier exists within the community. So,
well, how do I do that? Let's be specific. I'm a guy. I'm ready to pay because I'm hurting. I want to buy it. Where do I get it?
You go to Boston.
No, but there's no two-tier in Canada. That's my point.
There
is the two-tier.
There is a two-tier system. You're referring specifically to a hip surgery, but
I'm saying in Ontario, can I get a hip surgery next week? Let's be realistic. Next Tuesday, I want my hip surgery.
You cannot. But if you pick up the phone tomorrow morning and you decide that you want to use your American Express to buy a physical, you can pay the phone and you can call, just as another example,
but
and have that delivered.
It's not solving the problem I'm asking you to solve. I want people that can afford it to buy a hip surgery because they're willing to spend on it. I want that to benefit every Canadian.
Correct.
I want the equipment purchased by the wealthy that are willing to pay, and let those that aren't so lucky get use of it. That would be a great system to me.
So today and right now, you couldn't go out tomorrow and walk across the street and use your credit card and buy a hip surgery.
Well, that's un-Canadian. It should be fixed.
Within the next little while, within the next decade or two, and again, it's just an opinion and a prediction that one day you will be able to do that. You won't have to get on a plane and go to Boston and buy it there. You'll be able to buy it here. Hopefully, you'll never need to do that. But it doesn't shift completely overnight. And I think that's the point that I think people are missing, is that we have been buying healthcare as patients for a long time now in a certain way with very specific expectations. Our government has been delivering healthcare for a very long time now in a certain way with certain expectations. And what we're going through right now is a process of change management. We're changing an entire industry from start to finish, and that takes time.
Jeremy, great to have you back for this.
Thank you again.
Jeremy Behar is President and CEO of Cirrus Consulting Group.